also be pulled into that production. But the one of those bones that's most obvious is right here. And so we call it, it's one of those clinical symptoms that we see, that in thalassemia, these kids, their bone marrow is really revved up everywhere. Because when we do bone marrow aspirations, we don't typically go to the flat bones. Other kinds of symptoms on here that seem muddy.
With the hemophilia, the DDAVP, I know that increases the clotting factors, but do you give those in conjunction with clotting factors, or do you give that like before you would give the kid clotting factors?
What I want you to remember about DDAVP is that it causes any stored factor to be released so that it can be used. My experience, Courtney, with working with our hemophiliacs is that they don't all routinely take DDAVP, but we use the DDAVP when we're close to a crisis, a bleeding episode. It does have two routes that we give it. In the notes it says that it's given IV. It can also be given intranasally. Which is kind of cool.
So you would give that before you would actually administer extra clotting factors, you would release what's already in.
Have y'all dealt with different kinds of ports or permanent central venous catheters like Hickman's or Broviacs? Some of you not. Okay. Kyrene, you were not in your head. Were you not in your head that you have seen a permanent like a Hickman or a Broviac? Would you tell your classmates what it looks like?
Well, my patient's was underneath. It was like, I don't know, on their stomach. And it's like under, I don't know how to explain it. It's like a thin layer of skin was over it, and you could inject he was a hemoc.
So you're talking about a portacat.
Oh.
Okay, so tell your classmates about the portacat that you saw.
It was to inject his chemo, or if he has any injections went through the portacat instead of his, and they could do blood draws from it too.
So the portacat fits between this bone, and this is the air right here. And so this is that little skin place, and this little port, I think looks like a flying saucer. It's a little bit bigger than, it's about the size of a dollar, one of those dollar pieces. And on the top of it, it's got a diaphragm that when you palpate, you can feel the diaphragm. And you clean it off and you weigh, and then you take a special needle, and it's a 45-degree angle needle. That's not 45, that's 90 degrees. And so inside this part, this is where the reservoir is, and then it has a little piece that comes in here that goes into the vascular system. Okay. All right, so that's called a portacat. Has anybody taken care of somebody that had something either called a Broviac or a Hickman catheter? So it's a tube that's been tunneled under the skin and goes into one of our larger venous access places. But it's got this string out here, and it looks just like a T-connector. And you come over here and you clean it off and you hook it together. It doesn't require a needle. This one up here, a portacat, requires a needle to access. This one is great because when you take the needle out, you can go swimming, you can do all kinds of things because it's covered. The Broviac or the Hickman, and those are just brand names. The kids many times will wear their little net things that are like the girls' tube tops, so that these little tubes are not hanging down and they don't step on them and pull them out. But those are Broviacs. So when you look at that chart, anything we've talked about today, the notes, what kind of muddy things are muddy today?
Why are, I know this is but why are hemophilia patients I understand sickle cell and thalassemia, but
Okay, so why are kids with hemophilia in pain? And the answer is they're not all the time. So when do they have pain? When what, Megan?
are there painful joints?
So why do they have painful joints? Is this arthritis?
Like an inflammation.
Excellent question, because not everybody's got it. So if these kids bleed, because they don't have enough factor, what if they bleed? What if I get hit really hard on my arm, and I start bleeding and I cannot clot? Okay, it's gonna swell up, right? Okay, is there any extra space in here? What happens when things swell, get bigger, continue to bleed? What?
Sore?
So it gets sore. If I continue to bleed and it goes over here to this joint, there's some space in the joint, isn't there? Okay, but I'm still bleeding. Nobody's given me any factor yet because I haven't figured out what's the problem. And so now my joint is swollen, called a hemarthrosis. Another vocab word for today. Okay, tell me what's obvious here. Why do these kids hurt? Why?
They're like also they're just getting hematomas all in their skin and their joints, and then they can't move their joints, and it's gonna be painful to move them.
And so I have nerve endings here, and I have spaces that are normal, but if I squeeze too much stuff into that space, then it causes those nerve endings to be activated, and it hurts. So that's why our kids with hemophilia hurt. Okay. Excellent. Somebody asked me, is factor expensive? And the answer is absolutely, incredibly expensive. It comes in units, and a unit, the last time I checked, cost $1,700 a unit. And most of the kids that I've taken care of in the last 5 years, when they have a bleeding episode, they require somewhere between 500 and 1,000 units.
Goodness.
Yeah. It's a problem. A really big problem. Financially. This is why moms and dads have to go to work to make sure they're on insurance. Insurance sometimes says we really don't want to pay for this. Okay, so hemophilia. We talked about an arm. It hurts. I can't move my arm. But what are you as a nurse most worried about on a hemophilia person? No, airway and hand washing are always the right answer. Okay, but this is that isn't one of those times. Okay, what is it about your body? Where are you most worried about something that's going to What do we know about kids and what they do in normal growth and development? They fall, they run, they play, all of those things that are healthy growth and development. So when you study, you think about how do these diseases impact how these kids are going to grow and play? What are their parents going to be absolutely petrified about? How do you balance the need for the kid to learn independence, the need for the kid to learn how to walk, ride a bike, participate in group sports, go camping, take ballet? How does that impact? What does it do to the kid's self-esteem, ability to move to independence? I mean, the string just keeps going. All right. wanna stop here and say, is this kind of talk helpful?
Mm-hmm.
Okay? I think, I believe that this kind of work, this hands-on talking, writing silly paragraphs, looking at silly analogies, is helpful in a different kind of way. But work with me, okay? So this is a plan. It's not like I didn't want to teach. It's a different kind of teaching. Okay? So you think we're kind of done with this topic? Good to stop? Okay, can we talk about the housekeeping stuff? Okay.